Good morning to our lecturer and my fellow friends. My name is Coralia Dana Anaala. For our lesson today, we will study about body system, which is reproductive system. Okay, now we focus on female reproductive system. Before we start our lesson, we have 4 learning objectives. That is, in the end of the lesson, student will, number 1, define the reproductive system and female reproductive system. Number 2, identify the main organ of female reproductive system. Number 3, recognize the organ based on the 4 components, that is, disease, aging, injury, and disorder. And the fourth one is explain each organ that involved in its component, that is, disease, aging, injury, and disorder. Let's go to the introduction. What is reproductive system? The reproductive system of an organism, also known as a genital system. It's the biological system made of all the anatomical organs involved in sexual reproduction. The female reproductive system is made up of the internal and external sex organ that function in the reproduction of new offspring. In human, the female reproductive system is immature at birth and develop to maturity at puberty to be able to produce gametes and carry a fetus to full term. How many organs in female reproductive system? Yes, there are 5 organs of female reproductive system. Number 1 is vagina, number 2 is fallopian tube, number 3 is uterus, and number 4 is cervix, and number 5 is ovary. Female organ that we choose for disease is vagina. Another condition that affects women of reproductive age. It usually starts during adolescence, but symptoms may fluctuate over time. The mechanism of cause is a hormonal disorder that can lead the development of small fluid-filled cysts on the ovary. Basic cause is not fully understood, but it is often involved in imbalanced reproductive hormones, including elevated level of estrogen. However, the treatment for this PCOS is number 1, surgery intervention. Number 2 is medication, which is the patient can have birth control pills and anti-androgen medicine. Diet and exercise, that is adopting a healthy lifestyle with a balanced diet and do regular exercise. The second rehabilitation is physiological support. Support from mental health professionals, support groups, or counseling can be beneficial. The second component is injury. In the female reproductive system organ that have been chosen for this component is cervix. The cervix injury disease is cervical cancer is the growth of abnormal cancer in the lining of the cervix. The most common cervical cancer is carcinoma. Of cervical cancer is HPV infection. HPV is infection by high-risk human papilloma virus. It usually begin with the transmission of HPV through sexual contacts. Most HPV infections are transient and cleared by the immune system without causing any symptom. However, persistent infection with high-risk HPV type can lead to cellular change that may progress to cervical cancer. The second mechanism is integration of HPV DNA into host genome. In case of persistent infections, the HPV DNA may integrate into the host cervical cell's DNA. These integrations can disrupt normal cellular function and contribute to the development of cancer. There are 2 treatment for this cervical cancer. Then first one is cervical consignation. For this cervical cancer they have 2 rehabilitation. That is number 1, physical therapy. The physical therapy may be recommendations to help restore strength, flexibility, and range of motions. Second one is rest and recovery. Rest is often a key component of the initial treatment to allow the cervix to heal. The recovery process, it is avoiding sexual activity or using tampons during the recovery period. For this aging, then is fallopian tube. For the disease of aging in fallopian tubes is higher incidence of pelvic inflammatory disease, PID. What is PID? PID, which is can affect the fallopian tubes. It is more common in sexually active women and can lead to scarring and blockage. We move to the mechanism of this PID. The first mechanism is tubal blockage. That is, blockage in the fallopian tubes can occur due to infections, scar tissue, or other factors. Secondly, this blockage can prevent the normal passage of eggs from the ovary to the uterus, affecting fertility. The second mechanism is infection and inflammation. Infection of the reproductive organs, particularly the sexual transmitted infections, that is STIs, such as chlamydia, and sexually transmitted infections, STIs, such as chlamydia, can cause inflammations in the fallopian tubes. This is also known as salpingitis. Next, the treatment that we can help for this PID is surgery and hormone therapy. For the surgery, tubal ligations, reversals or tubal surgeries, and for removing blockades might be options. For the hormone therapy may be used to regulate hormonal imbalance that can affect the reproductive system. How about the rehabilitations? For the rehabilitations, the option can be chosen is counseling and support. During these counselings and support groups can provide emotional and physiological supports during the process. The last component is disorder. Some organs that have students is ovary. For this ovary disorder disease is bacterial vaginosis, that is BV. Bacterial vaginosis is a condition caused by an overgrowth of normal vaginal flora. The mechanism of this BV is imbalance in bacterial flora. Bacterial vaginosis occurs when there is a disruption in the balance of the normal vaginal flora. This imbalance can lead to the decrease of the number of beneficials in the number of lactobacillus and an increase in the harmful bacteria such as Gardnerella vaginalis, Atomobium vaginal, and others. For BV treatments, we can provide an antibiotic. There are many types of antibiotic that can be treated for this BV. For examples, that is probiotics. Probiotic, especially those containing Lactobacillus species, may help restore the balance of bacteria in the vagina. This can be taken orally as supplements or applied directly to the vagina. The second antibiotic is metronidazole. This antibiotic is often prescribed. This antibiotic is often prescribed in either oral pill form or as a gel that can be applied intravaginally. It is effective against the bacteria associated with BV, including Gardnerella vaginalis. The rehabilitation for BG is avoiding irritants. The patient must stay away from practice that can disturb the natural balance of the vaginal flora, such as douching. Use mild, fragrance-free soap for external genital hygiene.